Great, so we're going to be working on Sam today, and Sam came in earlier and he has a bit of an issue with his neck. Now in Bowen we tend to, particularly on a first session, we tend to address the whole body, and there are really good reasons for that. So for example, someone might have a neck issue like we have here, but the neck is so connected with the rest of the body. So for example, we have our back line, which is connecting really the occiput and all the fascial connections at the base of the occiput, all the way down the back to the sacrum. And so, for example, you can work on someone's sacrum and notice quite a change in and easing up of neck restrictions as well. So you've got these back connections, but you've also got the front connections as well, through from the base of the cranium all the way down the front here to around the pericardium and the diaphragm, and even through to the pubic bone and the sacrum. So that's why in general, on a first session in Bowen, we want to address the whole thing. And even in subsequent sessions, it's a really, really good idea to address the whole back in this case. So I'm going to start my Bowen work really with what we call the bottom stoppers. So I'm feeling for the iliac crests here. And with each of these moves, I'm really feeling and using them as an assessment as well as a treatment. So I'm feeling for the iliac crests, coming over, drawing a line towards his spine, and these moves we're going to do just above that line, and that's around about L4. So as I do this and I take the slack, I can feel what the tissues are like, and as we do that, I'm taking as much slack as I can, nice and slowly, going to the edge of the muscle, applying a challenge, and with his exhalation, moving over. And in some cases, we might want to wait 2 exhalations through that challenge, just to get a deeper sense of relaxation. So making sure I coordinate those moves with his breathing. So that's the bottom stoppers. Then we would normally wait a couple of minutes. So just going on to the upper back now, and in our Bowen work we call this basic relaxation moves 2, where we're doing some moves just below and above the level from the bottom of the scapula. So again, if I find that bottom of the scapula, that inferior angle of the scapula, and draw a line over towards the spine, I'm going to do a pair of moves just below that, over the erector spinae group of muscles. So I'm going to take some slack towards me. I'm going to turn, challenge, and again, this is very important that we do this with the exhalation. So as I go over, moving from one side to the other. And at this point, you might feel 2 or 3 different fibers of the muscle, because up here, they're a little bit more kind of spread out and go a little bit more lateral than they do in the lower back. So that's the first pair, and the second pair just a finger's breadth above that, where we're taking the slack towards us again, turning, challenging towards the midline, and moving over until we reach the spine. So nice and gentle, but the action is really one of trying to get the tissues to relax and melt under our fingers or our thumbs. I'm just using enough pressure that I can feel the muscles responding under my fingers, and trying to get that move itself on the full exhalation. So at that point, we want to have another 2-minute break. So these moves around the shoulder are addressing the trapezius muscle, which is this big muscle which attaches over to the top of the shoulders, comes down the back here. And beneath that, we have the rhomboids major and minor, which come at this kind of angle from the scapula to the spine. So to find our location here, we're going to take the inferior angle of the scapula again. And we can imagine from there, there's a straight line, that medial border of the scapula, which comes up towards that side of his neck. So towards the top of the scapula, which is kind of where I can feel here, we're going to start this move by placing our thumb about 1/3 of the way down that medial border of the scapula. And I'm going to very gently and slowly take some skin slack down, towards that inferior angle. Ask him to breathe. And as he breathes out, we're going to go out towards the spine, feeling those fibers of the rhomboids as I do it, and then come back up towards the top of the scapula. I'm going to lift my thumb, just drag the skin slack down a little bit, place the thumb back on. I'm just butting this finger up as a guide, but now what I want to do is go over the levator scapular muscle. A lot of people hold a lot of tension here, so we're going to do it nice and steady, apply a bit of challenge over it, and with his exhalation, drop my thumb. And as I do that, I can feel the fibers of it rolling under my thumb. So that muscle there, the levator scapula, is kind of coming at this angle up from the top corner of the scapula up towards his spine. So I could do the left to the right side, from this position if I wanted to, and I could do that around there and here, but I find it easier to come round and do that, so I'm going to do that now. And we're going to find our same landmarks, so the inferior angle of the scapula. If you're not sure where that is, you could also just bring his arm up, and as you can see there, if I do that, it accentuates it a bit. I don't normally do this in practice, but if you're lost, you can do that. So that's that inferior angle. And from that angle, we know that the edge of the scapula, this medial edge of the scapula, comes up in a straight line, really towards the side of his neck. So if I trace that up, I can feel the top of the scapula there. I'm going to start a third of the way down. And just drag the skin slack down towards his feet, following that medial border, watching his breath or asking him to breathe. So he's breathing in, and as he exhales, we're going to move out towards the spine in a kind of boomerang shape. So that's as far as I can go. And now I'm coming back up towards the top corner of the scapula. Lift my thumb and very slowly take as much slack as I can there. Put the thumb back again. Challenge onto the levator scapular muscle, and with his exhalation, drop down and flatten my thumb around the corner there. And as you do that, you kind of feel sometimes a little bit of crunching as you go over those muscles of the levator scapula there. And then again, we want to wait for a couple of minutes. So because of the connections down through the spine, it's very nice to work the middle of the back here as well. So I'm just going to do a series of moves, medial and lateral, up the spine there, starting above the bottom stoppers, which were here, and stopping beneath where we did the top stoppers there. So I'm just going to start on the left side again. I'm standing here, nice and relaxed. My elbows, my shoulders are relaxed. I'm taking the slack. I'm feeling that challenge, which is a bit firmer here. A little bit more resistance in his muscle at this point. And as he exhales, I'm moving over from one side to the other. And the same thing on the other side. So this is the right side, skin slack away. Challenge with my fingers. And moving over. And my other fingers are just resting nice and relaxed on his body. So to do the lateral moves, I'm going to just change my fingers over. So starting on the left side, skin slack towards the spine, challenging towards me, and moving over. And again, each time I'm just assessing, I'm feeling what the muscles are doing under my fingers or under my thumbs. And then we go to another pair of medial moves, and the skin slack towards me, turning, and over we go. And skin slack, challenge, and on his exhalation, move over. And then the last pair is a lateral pair of moves. So again, on the left, taking the skin slack right up to the spine, challenging on those muscles laterally, and moving over. And again, just noticing the quality of that move, adjusting my pressure all the time, depending on what I feel under my fingers and my thumbs, and trying to get the tissues to melt under my fingers or my thumb. So in our Bowen work, we call those moves 9 to 16. So the medial, lateral, medial, and lateral. And then we'll wait for a couple of minutes. So there's a few other moves that we can do around the shoulder area, but for now, we're going to turn Sam over and we will conclude with some work around his neck. So we want to address Sam's neck here. And the first moves we're going to do are over the side of the neck, over the scalene. So that's the muscles that come down the side of the neck here and go down onto the first and second rib. So you have your posterior scalene, which we're going to get, the middle scalene, and the anterior scalene here. So the way I'm going to do this is there's a very clear division here where his neck meets his trunk, and we're going to be right on that division really. So his trapezius muscle is there, and the posterior scalene sits just pretty much tucks right next to it. So I'm going to use my thumb just to rest in that little hollow there, just in front of the trapezius on the left side. And I'm going to take the skin slack back. So I'm slightly pushing the trapezius back, coming in a little bit with my thumb. And as he exhales, I'm following the contour of the neck around, and I'll feel the fibers of the posterior scalene and the middle scalene as I move over. So it's a fairly gentle move. All we're doing is really taking the skin slack into that hollow, just in front of the trapezius, going in a little bit, because that can be a bit sensitive, and just sweeping forward with my hand. And the idea of this kind of position here, where we've got a nice right angle between my thumb and my finger, this is really just acting as a guide as we go over. So I'll start on his left side, and then I'll do the same thing on his right. So again, that's his trapezius, which is the muscle obviously that goes over his shoulder and up his neck to the back of his head. And just in front of that sits the posterior scalene. So again, I'm going to use this angle between my thumb and my finger, and I'm just going to allow my thumb to rest into that little hollow there, push the trapezius back a little bit, and as he exhales, I'm going to sweep forward with my thumb over that posterior and middle scalene. So then I can come up to the muscles behind the occiput here, and these are the suboccipital muscles that attach down onto the atlas and the axis, as well as the other muscles that come down the back of the neck here. So the way we're going to find this is we're going to just turn his head just a little bit so I can feel for his occipital protuberance. And either side of that you have these various muscles that attach on and go down the neck. So we feel for that occipital protuberance, we come down a finger's breadth off it and out a finger's breadth. So I want to start on his left side. So I felt for my location, I've come down off the occipital protuberance, I've come out a finger's breadth, and I'll feel a kind of stringy muscle there. It's quite thin and not that distinct. So I'll just take a little bit of slack out laterally. I'll challenge medially and just drop my wrist and move over medially. Now some of those moves can feel a little bit sensitive, so I'll do the same thing on the right and just move over. So it's quite a short little move, just beneath and lateral to the occipital protuberance. And then we want to wait. So now we'll come back and do the last two moves, which are right in the middle here of the neck. So we could measure from the chin coming back, and if I bring my fingers behind the back of the neck here, feel for his spine, come out, I will feel these long muscles of the trapezius as they're coming down the neck. So now we're just going to take the skin slack out laterally, we're going to challenge medially, and I'm going to very, very slowly drop my wrists, until we feel a roll of the muscle under my fingers. So I'll do that on the left side, and the same thing on the right. So taking the skin slack out, challenging medially, slowly, slowly dropping my wrist, and moving medially until we feel the muscles roll. And then we can wait a couple of minutes, and if necessary, we'll repeat those last moves. So just to show you where the position of these last two sets of moves are. So we've done the moves over the scalenes in the front here, and then we'll come back to the back of the head. So we'll feel for his occipital protuberance, which is just there. And we come down a finger's breadth and out a finger's breadth laterally. So these little moves will take the slack on the left, challenge, and it's a fairly short move over. And on the right side, we'll take the slack, and again, challenge, and a short move over. And some of those moves can be a little bit sensitive. Then we'll have a 2-minute break. And for the last two moves, we're finding the middle of the neck. So that's his spine there. We come out laterally from there on the left and the right. And here we'll take the skin slack out laterally on the left. We'll challenge slowly. And as I drop my wrist and bring it round and move my finger, we get a roll of the muscle underneath my finger. So on the same thing on the right, gently with the slack, challenge towards the midline, and just move my wrist and fingers over.